Hey guys, we're going to talk to you about one thing today, and that is the topic of vaginal birth after C-section or VBAC. It's definitely worth talking about, especially if you've had one prior C-section in your previous history. One of the big things that you can look at that will tell you your likelihood of success. There's a model that has been developed by the National Institutes of Health to predict what things would indicate you have a better or worse chance of delivering vaginally after a prior C-section. It's one of the very first things I talk to patients about when they come in at their new OB visit, when they have a history of a previous C-section, is let's take a look at the model and see what your chances of success are. Fortunately, it's very straightforward now. There's an app for it. You can put in some very simple demographic information that basically relates to the patient's age, weight, height, ethnicity, and the reason for the C-section, and then also whether or not there have been any vaginal deliveries ever and any vaginal deliveries since the prior C-section. All those factors were found to be predictive for someone's chance of success when trying to have a vaginal birth after C-section. So I look at that right away with patients and show them the number. I just pull up on the phone, show them the app, and we're going to do one of those right now real quick. So I'm just going to pull the app up as I'm talking to you, and then I'll show you what it looks like on the screen here. Let's say we have a 27-year-old person who's 5'8", which is 68 inches tall, and let's say she weighs 165 pounds. And then we enter things like, are they, with regard to ethnicity, so African American, Hispanic. We're just gonna say yes to African American, therefore no to Hispanic. And we're gonna start off with any previous vaginal delivery and say no, and any vaginal delivery since the C-section, no, and then the indication for the C-section. That's the most important factor, really. And so for this first calculation, I'm going to say the question is indication for prior C-section was either arrest of dilatation or descent. We're going to say no. And so, for example, maybe you had a C-section because the baby was breech. So if we calculate that, if we say that it was actually the reason she had a C-section was because the baby got stuck, maybe got to 8 centimeters and was stuck there for 5 or 6 hours, if we recalculate that, now you're down to 47%. So like I said, the reason for the C-section is one of the most telling risk factors in this whole model. The other one that really plays a big role is weight, so weight for height, body mass index. So if we took that same 165-pound woman and let's say we made her 220 pounds, that now she's down to 36%. So weight plays a big role, as does the reason for the prior C-section. So you get a feel for the type of numbers that we're talking about when you just say, what's the chance that I'm going to be successful? And I think that's the most important thing to start with, because really the thing that most people come in focused on is, well, what's the risk of doing the C-section? And really the risk is quite small, particularly when you've had one prior C-section with what we call low transverse incision, which means lower portion of the uterus. This is the most common way that C-sections are done nowadays. About the only reason you might see a vertical C-section is when the baby was very premature, perhaps for breech babies, if the head was difficult delivering. In those situations, those are not candidates for a vaginal birth attempt. The risk is considered unacceptably high that C-section scar could rupture. So we're talking about low transverse C-section, preferably one prior C-section is ideal. And if that's what you're talking about, then your risk is about 1% that the uterine scar could rupture in labor. So 1% risk, 99% chance is not going to happen. And that's what I like to focus on. What's your chance of success? The risk is small, so are you a good candidate or not? And let each patient decide. There's a study that showed that if you presented in spontaneous labor before your due date, your chance of success was higher. Now that's not in that model that I was just looking at, but that's a separate study that did show that to be a predictive factor during labor. Did you show up in labor before your due date or after your due date? If it was before, it was a little bit better. If it was after, it was a little bit lower. But still acceptable, but that's just important to know. And then another one is spontaneous labor versus induced labor. There aren't great studies that tell us, but we know that in general, induced labor might increase the risk of a uterine rupture a little bit. So I just tell people to give you a feel for it. Let's just say it doubles the risk. So maybe you go from 1% to 2% risk. And when I say risk of uterine rupture, what does that really mean? It is, if it happens, it's a very serious complication. The uterus must remain intact to allow for appropriate perfusion of the placenta. The baby needs to get oxygen and be able to exchange gases that we exhale carbon dioxide, we inhale oxygen. The baby's placenta does that for them. The uterus needs to remain intact and for the mom to have a normal blood pressure for that placenta to function normally. If the uterus ruptures, all bets are off. The baby's probably not exchanging gas well, they're probably not getting enough oxygen, and they're not getting rid of carbon dioxide, and those two things can lead to brain damage. So if it happens, it's potentially really bad. But again, the point is the risk is quite low. That's the risk. We talked about the chance of success. Let's talk a minute about the benefits of having a vaginal delivery after prior C-section. They are primarily related to two things: complications from surgery and recovery. Complications from surgery. You have less risk of a problem if you have a vaginal delivery than if you have a C-section. Obviously, if you open up someone's belly to go take a baby out, you've got a higher risk of infection, bleeding, and damage to other organs in that vicinity. Primarily, you're talking about bladder. Could even be some bowel injury risk. Those are quite rare. But operative complications are higher, obviously, if you enter someone's abdomen than if you didn't. Now, vaginal delivery, you may have a vaginal tear. The vagina can tear, but it heals very nicely. Sutures help that to move the process along more rapidly, cut down on bleeding and things like that. So the body's really meant for a vaginal delivery, and therefore recoveries are just so much better in the vaginal birth. Now, there are maybe some exceptions. If you have a very severe laceration, say a 4th degree laceration, which means a tear all the way down from the vagina through the rectum, those can be difficult and painful to heal, but in all honesty, if they're repaired correctly and things heal well, your risk of complications that could affect you down the road are still lower than a complication from a C-section potentially. So that's the benefit of the vaginal birth over the C-section. Less risk and an easier recovery. Obviously, if you don't have a big incision in your abdomen that every time you move it hurts, and every time you pick up the baby it hurts, well, then clearly you're better off. It also allows for faster recovery, quicker return to sort of normal function in life. So big picture is one prior C-section, you're probably a good candidate, assuming there's a low transverse C-section, which they almost always are. If there's a question, we can review operative reports from prior deliveries to know for sure. One baby preferably, I didn't mention that before, but preferably one baby, although twins are not excluded, but it definitely increases the risk a bit. And most people would probably be a little bit hesitant about trying for vaginal birth, for the first vaginal birth after C-section if you have twins. Now, certainly if you've had a prior successful vaginal birth after C-section, then I think twins are totally fine. And there's a lot of caveats to that, but just sort of in general, reasonable to consider. That gives you an idea of the kind of things that I think about and talk about with the patient when they come in and they've had a prior C-section and now they're interested in considering or at least talking about a trial of labor after C-section and attempted vaginal birth. So I hope that information is helpful to you guys. I'll put the link below for the little model. You can put your own parameters in there and see how you as an individual would fare in that model. And if you have other questions, please feel free to put them in the comments below. And thanks for watching. Have a good day.